All right, welcome everybody. My name is Amy Hoffman and I'm with OSU Extension Services Outdoor School Program, and myself and Nell Hethman waiting to you all there with Gray Family Foundation, and I will be hosting the room today. And with that, Maria, I think I'll go ahead and turn it on over to you to introduce yourself and get started. Thanks again, everyone.
All right, thank you, Amy. Thank you all for joining this session. I'm excited to share with you a little bit more about mental health topics and mental health first aid. I'm Maria Dontakis Pos. It's a full Greek last name there, and just wanting to share a little bit about myself and then dive right in. I'm a training project manager for many mental health and suicide prevention trainings, and specifically also a statewide mental health first aid coordinator for Oregon through the Association of Oregon Community Mental Health Programs. So again, I'm excited to be here and share with you a lot of these topics and information. I also want to bring up that mental health first aid trainings are generally much longer to get into some of these aspects. And so this is just really a brief intro to this, but I want to touch on some common mental illnesses as well as stigma and some aspects of how to begin that part of helping and getting trained and more information to help others. So the session is, again, Introduction to Mental Health First Aid, and it's really about the journey to support those who struggle with mental health challenges, substance use challenges, and how we can help them on their road to recovery and healing. The main objectives for this brief time that we're together is really about learning how common mental illnesses are, increasing the awareness of the importance of mental health topics, decreasing stigma, and then again, learning specifically about mental health first aid and how that may pertain to you, and getting that further training to help and support those who need it. And so we'll begin with talking around the conversation. It all begins with a conversation and opening that dialogue to helping those who are struggling. And a lot of times, we term this as an awkward conversation because in our day-to-day life, we're so automatic in how we communicate. And to those we know and even those we don't know, we say a greeting of, "Hi, how are you?" And it's met with an automatic response of fine or good. And anything other than that is really not the typical norm of how we communicate. And we don't usually delve into some more topics of what might be going on with a person. And so I'm going to show a quick video of the awkward conversation and what it means to start this conversation and talking with those about mental health struggles or challenges.
I'm Danny. I've lived with depression and anxiety for about 12 years. And today I'm going to be opening up about those mental health challenges with some complete strangers in the hopes that we can start normalizing conversations about mental health. Hi, I'm Danny. Nice to meet you.
I'm Colleen. It's nice to meet you too.
Cecilio, nice to meet you.
How are you?
Doing well, thank you.
I'm doing really good. Yeah.
Doing good. Yourself?
I'm actually not doing so well today.
Okay, that's honest.
Oh, it's all right.
Okay. So
Okay. What's going on?
can you tell me a little bit more about it? Do you feel comfortable talking about it, or?
Yeah, I can talk about it. So I've been living with depression for a long time, and this week has been particularly hard for me. So a lot of people simply just don't know what to say and what to do when somebody opens up to them about a mental health or addiction challenge. And that's really where mental health first aid can be valuable. It teaches people a concrete action plan for starting a conversation and getting somebody the support that they need, whether that's treatment or just a non-judgmental listening ear. So was it a little unexpected when I responded that I wasn't doing well, us being complete strangers until this moment?
I'll be honest, it caught me off guard. You just expect the automatic response of, how are you doing? I'm good.
When you first meet someone, here there's like a huge distance.
I always feel like, how can I help someone else? So, and I know it's hard because you just want to be like, oh, sorry, okay, let me run,
And I don't think people do it because they're inconsiderate. I think it's because they honestly just don't know what to say.
Have you talked to anyone about this?
Sometimes I just don't want to burden.
Yeah.
Yeah.
I know it feels like that, but most of the time people want to help.
Yeah.
Like everyone kind of wants to be useful to other people, so they want to help you. So
Yeah.
don't feel like you're burdening them.
That was really, really nice.
That's so sweet. I like totally wanted to give you a hug, and then I was like, that might be weird, but okay.
No, that was like exactly like what you should have said.
Myself, I was thinking like, okay, this person is in need of help. Try your best. Listen to them. Sometimes that's the best thing you can do is just listen.
You know, if you had cancer, you wouldn't just try to you wouldn't will yourself to get better with that. And so I hope that people just start talking about it more.
Wouldn't it be refreshing if we could take off the mask?
Yes, absolutely. Be real people.
So how did you learn how to respond that way?
My father committed suicide when I was young, and it was like a really pivotal change. And I think I spent most of my life trying to avoid that and avoid talking about that and like the shame and the guilt. So I really made this decision to like learn how to interact with people and be empathetic and show people that someone does care about them even if I don't know you. I think people should just ask more questions, because it's like once you get to know the person and understand that it could literally be any of us, like any of us could have this at any point in our lives, how could you make a judgment on it?
Can I give you a hug?
Well, absolutely. I love hugs.
Thank you.
Okay, so you could see with that how these conversations can be hard or even awkward with bringing that up, but when someone's struggling with mental illness and what that means, and it's about the stigma that's around that and someone struggling, and it's opening that conversation dialogue and getting to know what's going on with someone to be able to support them. And so it's important of starting these conversations. This is just another kind of comic strip, but just another illustration of the complex level of people. So you may not be able to see all the words and what each identity of each person is saying there, but what it's showing is that ultimately we have multiple layers within a person. We can all get together, students come together, even the teacher and different people, and we come together and we see the surface level, but a lot of times many are struggling, carrying a lot within them and trying to put it aside to go through school and to go through life and have these barriers. And oftentimes, we want to build that empathy, have these conversations to really support someone who may be struggling. So for example, also this teacher here is aging parent divorcing. And so these things to keep in mind in building our empathy, that someone we're encountering maybe going through a whole lot, and is building that empathy and ways to communicate. And then also here, this young student carrying the baggage of homelessness or being homeless and struggling there and trying to put that aside just to function on a daily basis, and being aware of these aspects and how much harder it is with someone struggling with mental illness to function day to day and manage that without extra help and support. And I'm not going to spend a whole lot of time on this, and I think many are aware of Maslow's hierarchy of need, but the basic principle is that people need their physiological needs and safety met before they can progress to their full potential, and having their shelter and food and safety covered, that they can build on social interaction, self-esteem, and that ultimate self-fulfillment in schools and going further to be their best self. And so when we look at this, mental illness compounds each level of these, each layer, and it really just adds to that. It makes it that much harder for someone to get to that self-fulfillment. It doesn't mean people struggling with mental illness can't get there. It means they need that support. But just look at the struggles that it can take for just even the physiological needs when someone is struggling with mental illness to all of these levels. And it's building that and really supporting someone and understanding from a different perspective what that might look like for someone. So some things to consider. Most mental health conditions often occur in adolescence, and that is something that we want to pay attention to. We're finding that it's younger and younger ages, but through research and what can be measured, most of these mental illnesses start in early adolescence. So we see half of individuals living with mental illness experience onset of these by age 14. 75% of individuals living with mental illness experience the onset by age 24. So we're looking at these younger ages. That's when we're seeing the bulk of mental illnesses starting to establish and signs and symptoms are coming around. So it's more crucial than ever to pay attention to these early noticing of signs and symptoms in order to provide that support. People can and do recover with that extra help, and the better the outcome, the sooner the intervention happens with a person. This also shows how common mental illness is. With 1 in 5 individuals live with a mental health condition. And so if we think about people in here, how many we have in this room, just in this meeting here, and then we think about in our day-to-day lives, our families, we think about in our workplace, and in different settings, 1 in 5, that's very common. And think about that's just what's being reported. So a person gets to that point of being identified. So it's actually much more common, and it's just, you know, a lot of people around that stigma aren't identifying that there's a challenge or getting that help they need. So I want to highlight these 2 yellow points next, that less than half of these receive services. In fact, 60 to 70% of those who have a mental health condition have not been offered or received any evidence-based treatment or intervention. So we get to a point of, okay, now they're identified. We have 1 in 5 people struggling with a mental health condition. Majority of those aren't getting help or treatment. And when we think about, well, why is that? And a lot of times we can pinpoint it down to the stigma, and we'll talk a little bit more about that, but just illustrating that point of how common it is, but yet so many people can't get the help that they need. And lastly, undiagnosed, untreated, or inadequately treated mental health conditions can affect a student's ability to learn, grow, and develop. So it impacts that, where they're trying to get that self-fulfillment and go through those layers in the Maslow's hierarchy and get to that self-fulfillment. It impacts it. This is just another illustration showing the onset of these mental health conditions, and largely they can go younger. A lot of research isn't at the younger ages, but we're seeing it more and more. And so it's largely on the onset during early adolescence, younger years. And of course, the onset of mental illnesses can come later on in life, but we're seeing the bulk of these through younger years and adolescence. So we want to be able to help someone and support them and have those conversations earlier. And I'm not going to go through each of these, but again, this illustrates 1 in 5 youth experience a mental health condition. And then the circled part here is what I want to point out. Suicide is the second leading cause of death in youth ages 10 to 24. So again, just illustrating how important it is to have these conversations and really start that process to be able to have training and information to support those, to save lives and help those struggling. So in mental health first aid, we talk about some physical illnesses and mental illnesses and the impact these have on a person's life. And the definition of disability in mental health first aid is that disruption in a person's ability to live, work, and have relationships. It causes a disability in their life, and it disrupts or impacts their day-to-day living. And so that's what the term disability in relation to this means. And so we're going to do an activity where we're looking at several physical illnesses in comparison to mental illnesses and looking at that impact. What does that mean? Someone with a severe physical illness and their impact on day-to-day living, as well as mental illness, and what that impact is. And so what I'm going to ask you all to do right now, if you have a pen and paper, if you don't, we'll do your best to kind of do it in your head. But I'm going to pull up a list of physical illnesses and mental illnesses here. And I want you to take a look at them and rank them from least disabling to most disabling. Again, using that the definition of the impact it has on someone's life. And we know these vary for each person, but we're talking about the relative impact it has in someone's life, that burden, the hardship that it can create in terms of disability with that. So I'll put them up. And so again, put them in order on your sheet or in your head from least disabling to most. And if you don't have a pen and paper, just be thinking about which ones you think are on the least disabling side and most disabling side. So I'll give you about 3 minutes to do this. So I know we don't have a whole lot of time, but just in general, and so don't take too much time other than just in general what you think when you see these. So with that, you are all on track with what I'm trying to illustrate here. And when we do this exercise in person, we have people standing with actual cards of each of these and ordering themselves. And we kind of look at this and discuss or rearrange people based on what we think around from least disabling, at least impact to most impact in someone's life. So again, not necessarily comparing these because you can have also multiple and compounding ones, but just to illustrate a point. So I will show you now based on all of this. Again, as if we're in person, this is what it kind of would look like, but I will start listing them from least disabling to most. And so to give you that background, the World Health Organization did a study comparing the relative impact of physical illnesses and mental illnesses in the disability it causes in someone's life, the disruption. And so I will pull those up here. And so a lot of you were able to illustrate these. Gingivitis there on the lower end, low back pain next, uncomplicated diabetes, then epilepsy here, which often surprises people in the order. And then we have non-invasive breast cancer next, moderate depression, severe asthma, severe vision loss, severe PTSD, and then we have paraplegia next, and then severe chronic bronchitis, emphysema, severe depression next, severe schizophrenia, and severe dementia. So a lot of you got those extremes of the least disabling and the most, but I know that it's often shocking to see some of these more severe physical illnesses on the lower than some of these mental illnesses. And why do you think that is? You can go ahead and put that in the chat. Why do you think that is, that we're seeing some of these mental illnesses higher in the more disabling side? And Blake, yes, to your point there, it is very subjective. So we're in this exercise is based on the research, and it does vary per person, but we're looking at the relative general impact in the research that was done on certain people from these groups who indicated the impact. And so yeah, there's a lot of factors in it. It really depends on each person, but in general, this is what the outcome was. And yes, so there's a lot of good points being put in the chat right now. It's a lot around what you're saying. It's more invisible, less resources. It's difficult to maybe cope with. There's maybe not as much clear-cut medicine or things that can help that people have. And a big one that contributes is stigma. Exactly. As I was saying it, someone put it in there. Perfect. Stigma is a big part of this. So when you think about cancer even, or just other physical illnesses, the flu, or even if back goes out, things happen. What happens in a person's life? Usually you get a rally around of support. You have people sending cards, get well messages. You have people reaching out. You share this information and people are supporting you. People rally around. A lot of times what happens when there's a severe mental illness or even just a mental illness, people can't talk about it. There's an isolation, even within family members. It's not always discussed. And so when we're talking about the impact this has on someone's life, it causes that disruption because there's not people sending cards or get well messages or reaching out as often. It's getting better. I will say that by us talking about it, people getting more information. But it has created a burden. When we take research on all these people who struggle with these various illnesses, the impact was greater with those in mental illness. Yes, all good points. So why is it important to talk about mental illness? Just as we stated, what if we never talked about the flu or diabetes or cancer? At one point, cancer was stigmatized. People didn't say cancer, and it was a C word, and no one talked about it, and that stigma around it. And people suffered in isolation a little more around that, or felt guilt or shame about it. But now cancer's talked about. I hear it in the grocery stores. People are talking about it. There's people reaching out and giving support, get well messages, love around it. So that's kind of what we're hoping to have with mental illness and mental health challenges. It's that support. People need that support still, and that ability to have their loved ones care about them and talk about it and not feel ashamed that they're suffering in silence. So again, opening that dialogue and talking about it more. And so the big part of all of this with mental illness is stigma. And this goes into a lot of the language of how it's talked about. Using this terminology stigmatizes further, saying loony, nuts, loser, all of these words just in our day-to-day language. What does it do to someone who's struggling? It prevents them from getting the help. When we look at earlier, when I talked about 60 to 70% of people who have struggled with mental illness don't go on to seek treatment. This is why. They don't want to be called these names. Cray, crazy, druggy, wacko, all of these things. And so it prevents them from taking those steps. But we want to be able to support someone and watch our language. So it begins with us modeling, watching how we talk about things. Early cartoons say these words all the time, but what happens is if someone's struggling, they don't go on to get help because of the stigma. I'm just going to briefly talk about some of the myths and facts. Myth, people with mental illness aren't able to work. The fact is we probably all work with someone experiencing a mental health problem. Myth, people with mental health problems don't experience discrimination. The fact is 9 out of 10 people with mental health problems experience stigma and discrimination all the time. And here are just some more just to think about. Myth, people with mental illnesses are violent. The fact is people struggling with mental illness are more likely to be victims of crimes than perpetrators. So it's really paying attention to that. I know the media sensationalizes this sometimes, and a lot of those that are violent is compounded with substances or different things like drugs and alcohol that actually impact violence and different behaviors. But the truth is those struggling with mental illness are more likely to be victims and targeted and bullied. So a myth, mental illness is a character flaw or a personal weakness. The truth is it has nothing to do with being lazy or weak. And that's been the view of many years of that person just, they should try better. Can't they pull themselves up from the bootstraps? Can't they just get past this? But there's biological factors, genes, there's physical things that can be going on, brain injuries, the brain chemistry, and trauma is a big piece of that. If someone has a history of abuse or trauma and they're trying to function day to day, it's a lot harder than someone who hasn't. So it's building, again, that empathy around this. Myth, people with mental illnesses can never heal or get better. The truth is, with help and support, people can and do recover and they can heal. And it looks different for each person, but people can progress, and especially with that added support. A myth, it's all right to use the words crazy, nut job, weirdo. And we just talked about that. So the fact is using those words are mean and hurtful and can make a mental illness worse and or lead to depression or suicidal thoughts. Myth, mental illnesses are rare, as we saw. The fact is, it is more common than AIDS, cancer, diabetes, and heart disease. So we really want to pay attention to the need to help those struggling. In our trainings, we talk a lot about trauma, and all mental illnesses have trauma as a risk factor. So if someone experiencing trauma, there's an increased likelihood of getting a mental illness. However, it doesn't mean someone who experienced trauma is going to go on to automatically get a mental illness. So we want to be aware of that as well. But there is an impact of trauma on people's day-to-day living, kind of like we saw with Maslow's hierarchy. It's harder for them to get through those pieces of self-fulfillment and reaching their highest potential. So with impact of trauma, there's decreased IQ and reading, lower grade point averages, more days absence at school, suspensions, decreased high school graduation, things like that. And then bringing in the pandemic recently with COVID and what that means on mental health. Now it's too early to know the full length effect on this and mental health and what that means, but there's some initial research that's been done, and the factors that contribute to affecting mental health around this time is the widespread social isolation, job or income loss, stressors and traumas, and again, stigmatization. So we see how that really impacts people and their functioning, which results in increased anxiety and depression, hopelessness and grief, and not just grief and losing someone to COVID, but grief of the changes, the fear around what's happening, job losses, different things that might be impacted as a result. So it's not just a medical phenomenon. We're seeing it's affecting people and with anxiety, stress, stigma, xenophobia. And there's just some initial studies and cases that they're trying to figure out on the impact, and one showing that this led to anger, confusion, and PTSD symptoms in some, and just it has an impact on others. So it's, again, what can we do? So some ways to help, especially with building mental health, is during this time focusing on taking care of your mind, keeping a regular routine, even amongst all this change in some people's world. There's a lot of chaos. Trying to keep it as regular as possible, limiting exposure to news media, and mostly around, that can be traumatizing in itself. And there's secondary trauma or vicarious trauma from news or the way it's sensationalized. And I'm not just talking about news around COVID, but news around any kind of violence, death, dying, which can impact especially the younger kids, and those exposed to it actually can cause a traumatic effect that we've seen with people. And a lot of this was at the Twin Towers when that happens. The secondary trauma from watching that impacted many. There were studies that were done that show that people just watching that on the news got symptoms of PTSD. So limiting exposure to news is a healthy way. We want to be informed, but not at a level that's going to be mentally paralyzing and damaging as well. So staying busy, we want to have healthy distractions. We want to be informed, but just balancing our life so it's not lopsided with all the harshness and heaviness going on. Making connections, reaching out, again, that support piece, and reaching out and checking on people and seeing how they're doing, and supporting family members. So taking a break from news and media, connecting with people and educating ourselves is really the best. And what more can we do? A lot of this is getting trained. Again, these trainings I'm going to be talking about, increasing your mental health and suicide awareness, are going to be helpful. You all provide a unique position where you interact with people either you work with or students or a variety of people, and even in your families, you all can be that support person in noticing these early warning signs and emerging mental health conditions. And that's part of that. What the training helps is equips you to notice these early on before it becomes a full-blown crisis, and to help earlier for better early intervention. The earlier you help, the better the outcome. So it's just one of those things that you all can be the connectors of resources, that be that initial person to help. So again, some trainings to help you become more mental health awareness and suicide awareness. Mental health first aid being one. QPR is a shorter one, 90 minutes. That's more around specifically suicide. And there's assist. Sources of Strength is a wonderful one for youth, and it teaches building positive protective factors to balance out a lot of risk factors in students, and it's building that up so that they're equipped to cope when adverse events happen. And then there's further clinician type trainings to immerse yourself if you're interested in learning even more. So what is mental health first aid? How many of you, I guess you can show your thumb or click the icon there, have taken CPR first aid? Or at least know of it. So most people, yes, I'm seeing a lot there. So most people are aware of it or have taken CPR first aid. And this is the mental health approach to that. So that's the equivalency in the mental health side of things. And what that means is it's the initial help offered to someone. So just like CPR first aid, if someone's trained in that, their initial help there until the appropriate professionals with more training come along. They're the initial connector, they stabilize, they help with the person until the appropriate professionals come in. Same with mental health first aid. You're not expected with this training to diagnose, treat, or know all the ins and outs of the mental health field, to know everything when you encounter someone. It's about that initial help. You're seeing these signs, early signs and symptoms. You're connecting a person to the appropriate people, how you're having these conversations and what that looks like to connect. So some of the disorders we cover in mental health first aid are the more common ones, like anxiety, bipolar, depression, and then psychosis isn't a disorder, but there's a lot of fear and stigma around that one. So that's talked about in there around hallucinations, delusions, and how to talk with someone or even help someone in that situation, and then substance use disorders. And we also go into how are you that initial help when you interact with someone in a crisis. So if someone has suicidal thoughts, traumatic event, panic attacks, or acute psychosis. And what does that mean? What do you say? What do you do in those instances? So we also train someone further to feel comfortable and more confident into handling these that come up as well. And a big part of a section in the training is suicide and what that looks like in asking the question. And we talk about asking directly, like the direct road to asking someone, are they thinking of suicide? Are they thinking of killing themselves? And how important that is to ask that. Again, because of the stigma, most people aren't willing to give that information or share that. It really takes someone, a caring person, to ask some of these hard questions and these awkward conversations. We talk about that and we practice that in the training, but just knowing how important it is to be able to communicate directly about some of these and save a life. So just like CPR first aid, there's the compressions, airway, breathing. In mental health first aid, we have an action plan as well. And so you learn how to assess for risk of suicide or harm. You learn what listening looks like in situations around mental health, giving reassurance. And a lot of this is around conversations, what that means, having that dialogue and how to talk about things, what to say and what not to say, and equipping people to feel more comfortable having these common conversations. And it is an evidence-based training and has been proven to help encourage those who with getting help and the impact of increasing knowledge and understanding and the confidence and being able to help someone or start these conversations. So the ultimate positive goal of mental health first aid is that resiliency and recovery is possible. So we don't want to say it's all doom and gloom and there's nothing we can do. It's a struggle. People can and do recover. And it's just, we want to get to that place where we support it. Recovery looks different for each person. For one person, it might mean they need to manage their medications daily to function and be their highest self-fulfilled self. Another person, it might be just an episode. They struggle a period in their life and then go on to have no other mental illness. And it just keeping in mind that it looks different for each person and getting away from our preconceived notions of what a healthy person looks like, because it depends on each person and their health and what that means for them to live day to day. So potential audiences who take this are basically anyone who wants to get that mental health awareness. Again, like CPR first aid, we want to make this more popular than CPR first aid because you're more likely to encounter someone with a mental health challenge or a crisis than you are a physical health crisis in your day-to-day. So we want to equip many more people to understand this, and you all are a good audience for that. And you can see there's so many others that have taken this and benefit from that. And this is a little bit of an outdated map because it's growing significantly, but mental health first aid trainings are available nationwide and you can go anywhere, and they're offered virtually as well, but they're offered nationwide. And in Oregon now we have over 30,000 people who have been trained in mental health first aid. So that many people having these conversations and getting more equipped and confident to offer support and help and connecting someone to help. So some resources, mental health first aid, the training itself is a resource, having that action plan. There's other trainings. ESA, I want to bring up as its Early Assessment and Support Alliance. That's a wonderful resource for you to look into. For those youth or young people that are experiencing hallucinations, hearing voices, things like that, and we may not know what to do with that, ESA is a free support system, and you can call them if you're working with a youth and have them reach out to the youth. They engage, they make all the effort to get someone who's afraid, newly experiencing this, the voices, things like that, and help them early on, because they know the earlier you help, the better the outcome with that as well. So just some resources to make sure you have available. One I suggest that you all do is plug in the National Suicide Hotline into your phone, because when we're in a crisis with someone for mental health, we don't always have the sheets of paper necessarily. So if you have that in your phone, you can have talk with someone. You can call the line yourself and say, I have a youth or a person I'm with that needs help. And you can talk, they can help you talk through that, or they can talk to the person directly. And there's ways that they connect to a local crisis center. And there's other teen-to-teen texting. You can call for people. Again, it's not just around suicide or extreme mental illness challenges. You can call, people have called that for breakups and different things that could lead to further mental health symptoms. So it's helpful to have that and other, a safe tip line, things like that available. And then lastly, I'm just going to leave you with the video, and then we'll should have some time for questions. So okay, so that just illustrates we want to start having the conversations. And with this final quote, the only journey is the journey within, and basically illustrating that everyone struggles differently within mental illness, and each person's road to recovery looks different. And we want to honor that and just be a support and be trained and learn more to be able to help those in need. So with that, I'm done. And if there's any questions, I'm happy to answer. Yes, and there is going to be an upcoming mental health first aid training that you will all be able to sign up for.
And I just put that link in chat in case you didn't see it. And so I've taken the spotlight off Maria. So if you feel like going back to gallery, I invite you to do that now. And feel free to ask any questions you may have. You're welcome to unmute and ask them or put them in chat, whatever is most comfortable for you.
Probably there, I can see you all better this way. Good to see you all.
Thanks so much for being with us. That was a great overview.
Thank you.
I just wanted to say thank you as well. Made me kind of emotional because I've gone through some severe depression and psychosis and different things like that. Had an episode before, and just to be able to help other people and kiddos is, I think, something I want to be able to do, because I know how important it is to help early on versus later, because the road to recovery can be a lot tougher.
Yes.
Yeah.
Thank you for that. Yeah, thank you for sharing. And so we know we can help. We still want to help at any level that they're in, but I absolutely agree that sooner we can build our noticing skills and help someone, the better the outcome. But we always want to support, but yeah, everybody's road looks different in this. And it's just like, I love the initial conversation, the awkward conversation of it. It can be anyone. We can have down days, and yes, having ups and downs and sad periods doesn't mean we have a mental illness, but it could be anybody that we know that spirals into more of a mental illness, and we want to be able to reach out and support and rally around. Oh, I love that question, Caroline. So I will say, we don't portray it as much in the curriculum because it's really cautious around making sure that the studies back it. But a lot of what's talked about in the trainings is around the younger ages that we're seeing it more and more. It looks a little different, and more research is coming around. So mental health first aid is looking at the elementary age and younger ages. And so it can be trickier to spot in younger. So a lot of times anxiety, it shows up as anxiety, and we see that sometimes as ADHD, but we also want to be careful. And I think that's why there's not a lot of let's go labeling early on. We don't want to stick someone with a label because they can change so much, but we want to pick up on when someone has more anxiety, and we pick on when someone has more anger or disruption, and that really shows up later, when they're in adolescence, becomes identified as a mental illness. So absolutely, if we're trying to look at younger ages, and like I said, I don't have all the statistics and research yet for that curriculum in this program, but it's spotting those little things that are disrupting. When we talk about disability and that disruption and impact in someone's life, when it looks like to a person that they're having more anxiety early on, and we can spot that, and that has been identified at younger ages. So I know I don't have like specific links or resources to point to that, but I know that's one thing that you can also apply some of the signs and symptoms when you look in these courses to the younger ages, and we've seen that in younger ages too. And so I also worked as a psychosocial rehab specialist and worked with the younger ages and in schools, and that's how it largely came out. And I try to avoid the label so much for them at a young age, because again, you want to treat the symptoms of that and not go on to just label, because I've also seen many at a young age get mislabeled. So I think that's the caution around that, but just picking up on the extreme. When it becomes extreme and disruptive, it impacts their life and others around them, then we want to address those symptoms early on of anxiety and anger, which for depression shows up as anger a lot of times. Yes, Erica.
Thanks. One question and then just a reflection. The question is, does OSU, for that mental health first aid, I'm really grateful that it's being offered. I plan to take it as the program director of outdoor school programming, but I wonder if there's a stipend offered, and you probably can't answer this, Maria, but I wonder if there's a stipend offered by OSU for my team, my instructors. So that's the question. And the observation is working with schools. When I've talked about our focus on wanting to bring social emotional wellness into our curriculum, I've received the feedback of, oh, that's great, but what we really want is, and I'm just really curious how we work within an institutional system to change that focus without starting with social emotional wellness. We can't work with kids. So it's just, I don't think there's an answer, but it's just been an observation of what I've been hearing from administration.
Thank you for that. And that has kind of been an ongoing struggle as we try to get this more, not just this training, but more social emotional learning in there. And it's challenging because I hear you. I feel like, how can students learn? Like, we looked at Maslow's hierarchy. That's how can a student learn when they're carrying all this baggage and trying to put that aside if it's that much harder. So you can't really separate it. And you see how common mental illness is, and it's even more common because most of it's not even identified, but it's how can we help people learn and get forward and do these pieces of education and academic learning if they can't address these other aspects. So yeah, I hear you. I know I wish there was a magic answer to that. I hear you completely. So thank you for that. And then I think there's another question. A strong message here has been, let's talk about it. Any tips of the language to use when talking to kids about mental health? Oh, absolutely. And I know we're running out of time here, but we talk about that in the youth mental health first aid with, how do you describe mental illness? How would you talk about it to younger kids? How do you describe that? And we talk about, and I can't spend all the time here to go into that, but language to use and not to use. We talk about what's helpful and what's not helpful, and how you keep it more open and more letting them lead in describing it, but we also want to go away from some of the stigmatizing language around it. And a lot of times the younger ages, it's describing it as there's a chemical balance that's off in someone, or there's different ways to, especially the younger, so I'm talking really young when they can't comprehend what that means, but it's talking of using language, mainly following their lead in when talking with someone like older, elementary or younger ages, as well as middle school, and letting them talk about when they themselves are struggling, and really getting into avoiding stigmatizing languages, or you're not depressed or something, or and also we talk about person language, so we talk about a person who struggles with depression or experiences homelessness, that's a schizophrenic, and we want to get away from that, because the person is not just that, their identity is not the mental illness, and we have to get away from that, because a lot of times that's how it has been, is the identity of a person is the mental illness, and so that's adding stigma. And so when we talk about language and how we talk about things, is being careful. I mean, we're not here to police others, but we can be models of how we talk about things, and we can make mistakes. It's a societal thing of how it's talked about. And it's just being aware that, like, when I brought up myths and facts, it's, some might think, well, that's a lazy person, but it's about, there's biological factors, there's genes, there's brain chemistry, and that's how we can talk about that. It's just like someone having a physical illness. This is an illness someone is struggling with that needs that support. So without taking too much time, I'll just end with that, but happy to chat or leave my email if anyone has more questions.
Yeah, I was just going to ask, are you willing to share your email in chat?
There we go.
Oh, great. Thank you so much. And tell us the organization you're with again.
The Association of Oregon Community Mental Health Programs. So mouthful.
And are you all involved in the Oregon Coastal Forest research?
Yeah, so I operate statewide with supporting building of trainers and then supporting them to offer trainings. And so I did work with those at the Coastal Forest Project, and we co-hosted a Train the Trainer for this. And so while they're doing their own kind of project to spread the trainings, I work with those to support trainers, and I continuously support the trainings happening in that way.
Oh, cool. I got to do the mental health first aid training, so I highly suggest it to you all if you have the time. And it was really great. And so now I'm hoping to be able to do a Train the Trainer.
Woohoo, yes.
So hopefully maybe I'll be getting to see you more.
Yay.
Well, lots of thank yous coming in.
Thank you all.
We really, really appreciate you. Thanks for being here and sharing this important work and information with us.
And thank you for all you do. I know that's important, and you're directly there interacting and helping, and it's just more crucial to have as much information as possible, and also know that you can't be everything, and just have compassion too for yourself.
A good reminder. Yeah, these folks on this call are the ones out there with our kids and with our youth and doing outdoor school. And so we are definitely so grateful for you all too. All right, y'all. Well, I think I'm going to go ahead and stop our room, as hard as it is, and get ready to head to the next session. I hope you all are enjoying the conference so far. And there's, oh my goodness gracious, I'm supposed to share the eval with you. Hang on. Hang on one sec. Let me get you that link before we take off, and then we'll call it. And so if you heard the opening session, I just want to reiterate that we do use this feedback. So a lot of last year's feedback was used in designing this, and some of the curriculum surveys that Christy sends out or sent out rather, I think there was just one big one, also informed this. So please know that we really do take your feedback seriously and try to incorporate it in our gatherings and our workshops and things. So please take the time to do these if you are able to, and enjoy the rest of the gathering. And I will probably see you again. Bye.